Welcome to Birth Unafraid. Today we're going to talk about choice of birthplace. Now, to many of you, you may be thinking, what choice do I have? I have to have my baby in the hospital. Isn't that what you do? That's a pretty common understanding in the Western world, anyway, that birth must be in the hospital, that that's the only safe place to be. Well, I'm going to talk to you about how birth at home is safe, can be safe. Now, it can be unsafe as well. We'll talk about that. But what makes home birth safe for women? Now, the first thing to know is that anybody planning a home birth should seek the care of a regulated healthcare provider, a midwife. Now, not every jurisdiction has midwives. So in Canada, midwifery became legislated in the province of Ontario first, and that was at the end of 1993. So it's been around for a little while, but not for as long as you would expect. Before that time, there were midwives, but they were what we call unregulated healthcare professionals. So they would get training at various places, practice in different ways. And so one of the things that makes home birth safe is having care providers who provide similar care, a similar type of safe care. So when you are planning a home birth, your midwife, or if you have a family doctor who does home births, they will be doing what's called risk screening throughout your pregnancy. So basically, assessing you, talking to you, looking at labs, ultrasounds, that kind of thing, to figure out if you are what we call a candidate for home birth. There are certain things that risk screen people out of having a home birth, that because the risk would be too great for mom and baby if you did birth your baby at home. So one of these risk factors would be, depends on your jurisdiction, but I'll just name a few. So it would be, let's say you've got twins. So twins, the research shows that it's better to be birthing your baby in hospital for that. Breech baby is another. High blood pressure, diabetes is another consideration. So certain things that decrease the safety of home birth. So your midwife, their job is to risk screen and let you know if home birth is a safe option for you or not. 85% of pregnancies and births around the world are what we call low risk and healthy. And more than likely, that's where you sit. That's more than likely the type of pregnancy that you have, and more than likely the birth you're going to have. But there is a percentage of pregnancies and births that are higher risk. So anybody who's considered high risk would not be an appropriate candidate for home birth. So let's assume that your pregnancy is going along normally, nothing out of the ordinary in terms of screening you out of a home birth. The other piece to know is that your healthcare provider brings sort of like a mini hospital in a few bags to your home birth. So drugs to control bleeding if there's excessive bleeding, IV fluids. There is what we call a Doppler. I'm sure you've had your baby listened to by a little handheld machine called the Doppler. Midwives use that at home, and they listen to the baby as often as they would in the hospital. They listen to the baby the same way they would in the hospital. So the standard of care in North America is what we call intermittent auscultation, which means listening every few minutes with a handheld Doppler, listening to the baby's heartbeat to ensure that it's normal. So that same kind of care is provided in hospital or at home for low risk healthy women. So your midwife does that at home. The other thing she brings is resuscitation equipment in the event that the baby comes out and needs some extra support. She brings materials to suture, to stitch if there's any tearing or a need for an episiotomy. Freezing for that. So stitching is done with some freezing. So basically bringing everything they need that would make home birth safe for mom and baby. There are also typically 2 midwives at every birth. So you have the first midwife who's there for the active phase of the labor, and then the second person, it's either a midwife or what we call a second attendant, somebody else who is trained in assisting at birth. They will come closer to the end when the woman is pushing. So you've got two people there to help out, one for mom and one for baby. The other thing that makes Homebirth safe is having a good backup system. So having a hospital that does obstetrics within a good time frame. So there was a document put out by the Society of Obstetricians and Gynecologists of Canada a number of years ago that talked about how quickly a care provider in the hospital should be able to start a cesarean section. So if you are an OB at a hospital that provides obstetrical care, you as an OB should be able to start a cesarean section, not finish, but start a cesarean section within 30 minutes of identifying something abnormal that would require a cesarean section to take place. Okay. So that standard isn't 1 minute, 5 minutes, 10 minutes, it's 30 minutes. And the reason for that is, for instance, in our area here, we have a hospital that has 17 labor and birth rooms. So people labor in there and birth their babies in there. There's 17 of those rooms. There's one obstetrician on call for all of those rooms. Okay. So you could have an OB in room 12, where in room 17, now we've got an abnormal heartbeat and we need to do a C-section as soon as possible. So it takes time for all of this to happen. And that's just the reality. The other thing is we don't have, so there's no OB standing outside of every single door. There's no anesthetist standing outside of every single door waiting for something to go wrong. There's no physician assistant, a surgical assistant outside of every single door waiting for something to go wrong. These people are on call, they're available, if it takes time for them to get there. It also takes time to prep a woman. So she needs a catheter, she needs an IV, she needs an epidural topped up, or she needs a spinal put in. So all of that takes time. And that's just the reality of obstetrics. So that is the standard of care. So when you're at home, find out how quickly you would be able to get to hospital with your midwife via ambulance, 911, and see if it's within that time frame or not. So the faster you can get to the hospital, the better. But there is that sort of average cushion of about 30 minutes or so that make home birth safe. Now, that's not to say that if you live 45 minutes away from hospital that you can't have a home birth. That's just keeping in mind that services might be slightly delayed. It likely won't have an impact on your outcome or your baby's outcome, but there's a small chance that it might. So just to keep that in mind when you're making an informed choice about where to birth your baby. So the key to a home birth is having a low risk healthy pregnancy, is to have a care provider who is risk screening you throughout your pregnancy, but also risk screening you during your labor. So listening to the heartbeat, taking your blood pressure, taking your temperature, assessing, making sure everything is going normal. One of the things to know, and I mentioned this in another video, is that most of the time, if a transport happens from home to hospital, it's for what we call non-urgent situations. So somebody wants pain relief, or labor is slower than anticipated and we need some type of intervention to help with that. In that case, no ambulance needs to be taken. You're driven in car by your partner or your labor support person, and then head into hospital. The one thing to know that when either way, whether it's a non-urgent or urgent transport from home, your healthcare provider, your midwife, your family doctor is calling the hospital to say, hi, it's me, here's this client, and that client already has their files there at hospital. Again, it just sort of helps with that smoothness should things need to be moved into hospital. They'll let the charge nurse know what's going on and what kind of assistance they need, if any. So for instance, you could say I've got, Jane Doe here with me. It's her first baby. She does have her records there on file. She's O positive, and the baby's heart, everything was normal. Progress throughout labor, baby's heartbeat is abnormal. So we're moving in to put her on the continuous monitoring, right? Or I'm very concerned about the heartbeat. I need Dr. So-and-so in the room with me when I get there. In my experience as a midwife, when I worked as a midwife in the 25 years that I worked as a midwife, the rare times that we had to transport from home to hospital, every single circumstance, I can tell you 100% of the time, we always were waiting for the obstetrician and anesthetist and all that to get there. meaning not that they were, delinquent. My point is that even had we been in the hospital, the timing is the same. There's no difference. And that's the key. A lot of people have that view that they want to be in a hospital just in case something happens. The reality is the timing is the same. So that's something you can think about, consider about, pray about, decide whether home birth is something you would like to look into. One of the things to know about home birth is that typically interventions are lower at home. APGAR scores are better for babies, and that is the score that's given to babies to let us know how they're transitioning after they're born. They tend to be a little bit better at home. Episiotomy rates are lower at home, other interventions. So there are lots of benefits to having your baby at home. So that's just something for you to consider whether that's something that you want to do or not. Again, if you are planning a home birth just in case, we encourage people to let go of that just in case, because what that does is that causes that subconscious fear response to happen. You're not even aware of it, but your body is saying, we need to be afraid of birth because, that's why we need to stay in the hospital. All right. You want to get rid of that. If you're planning hospital birth, you're simply going to be telling yourself, we're having a hospital birth. End of story. No whys, ifs, whats. It's just, that's what it is. Lose the bit about the just in case. Don't even talk about that, because you're going to be, as I said, releasing that for the stress hormones rather than the relaxed one. So I hope you find that helpful. And again, if you can like and subscribe, that would be great. Thanks so much. Take care.